recording.
I don't know nothing about birthing no babies, Miss Scarlett. While this is a famous quote from Gone with the Wind, I think that a lot of us could say that we've never really thought about it. I know that I haven't, but maybe you have if you've gone through it. I became interested in midwifery in the 10th grade, and I've done a lot of research on it because I was fascinated with the birthing process. Using a midwife, either in your house or in a birthing center, is better than using a doctor in a hospital because it is just as safe, you focus on more natural pain methods, and there is little intervention in the birthing process. Women have been having kids for thousands of years at their house with no help. So the idea that a woman needs a doctor by her side every step of the way is crazy. While there is always a chance that something could go wrong, sometimes what goes wrong is because of something that a doctor or a nurse has done. Many people will switch to using a midwife instead of an OBGYN for more personal care, in the same way that you may go see a physician's assistant or a nurse practitioner instead of a general physician when you have a cold. If you use a CNM or a certified nurse midwife, they have undergone a master's degree in midwifery, and they have had just as much training for normal birthing and prenatal care as an OBGYN has. Midwives do not have as many patients, so they know you and your story better. If it is just as safe, would you rather have a cold person there delivering your baby or a caretaker by your side every step of the way? We all know that birthing is a painful process, but have you ever thought of alternative pain methods? While the epidural is a great invention, it can leave your body numb in the spot that it goes in forever, and it may not even work. Also, the epidural has to go in at a certain time, so what if your pain starts too early or your pain starts too late to have it? Have you ever thought about what you would do then? The midwife is there the whole time, so they can give the mom a massage during her labor if she wants one. The woman also has the freedom to do basically whatever she wants since she is not bogged down by hospital regulations. This means that she can immerse herself in a bath, even leading to a water birth, take a walk around the hall, even outside, or bounce around on an exercise ball. Whatever the mom wants to do, she's allowed to do to keep her pain at bay. The midwife may also administer some natural form of pain relief, such as an herbal remedy or some other kind of pain relief that's not given through an IV. The midwife is there to encourage and coach the mom there every step of the way as naturally as she possibly can. Now, intervention is a hot topic in today's world in the birthing community. C-sections have increased dramatically over the last 50 years. There's been a 500% increase in C-sections over the last 50 years, but this doesn't mean that birth has become 500% more riskier. It means that doctors have more patients, they're getting overwhelmed, they don't know the whole story, and they're ready to go home, so they come in and cut the mom open. Also, every birth C-section that a doctor has leads to more money in his pocket. Doctors and nurses can kind of set a birthing schedule, but we all know that your bodies were made to do birth naturally, which is what midwives advocate. Midwives are also strong proponents of automatic cord clamping. Actually, midwives are also strong proponents of not automatic cord clamping, while doctors will cut the cord automatically. Midwives they go along with what the World Health Organization says, which is to cut the cord 1 to 3 minutes after birth, or even until the cord stops pumping. Any intervention in the birthing process will lead to an IV and slower contractions, which makes the pregnancy overall riskier, leading to an increased chance of having a C-section or other complications. The less intervention that is present in the birth, the better, and that's what a midwife birth will lead to. In conclusion, midwives are the best option for your birth because it is safer, they focus on natural pain relief, and there is very little intervention in the birthing process. While this was brief, I hope that you now know more than Miss Scarlett's servant about giving birth. While it is a little old-fashioned, just like Gone with the Wind is, it is a great alternative to having a baby in a hospital. I challenge you to do the research for yourself and find out what is best for your baby and your body when the time comes for you or your partner to have a baby.